Hypertension affects 1 in 3 U.S. adults and increases one's risk for cardiovascular disease and stroke, two of the leading causes of death in the U.S. Per the 2017 ACC-AHA guideline, hypertension is now defined as a blood pressure greater than 130/80, a change from the previous definition of 140/90. Because hypertension often has no warning signs or symptoms, it is crucial that patients have their blood pressure checked regularly. However, blood pressure readings are not always accurate, particularly in clinical settings. Patients with white coat hypertension often experience stress or anxiety in a clinic visit, resulting in elevated blood pressure values compared to those obtained in a non-clinical setting. This can lead to unnecessary or overuse of antihypertensive treatments, needlessly increasing healthcare spending and exposing the patient to unnecessary drugs. Masked hypertension occurs in patients who experience normal blood pressure values in clinical settings, but have elevated blood pressures in non-clinical settings, leading to undiagnosed hypertension and risk for developing cardiovascular disease or stroke. To get a more accurate reading of the patient's blood pressure, providers may turn to ambulatory blood pressure monitoring, or ABPM. Ambulatory blood pressure monitoring involves requesting patients to record automated blood pressure values taken outside the clinic with a small portable machine that records blood pressures every 20 to 30 minutes over a 12 or 24-hour period while patients go about their normal activities and while they sleep. This is different than self-monitored blood pressures, in which patients may have their blood pressure checked manually in a number of community settings such as a pharmacy, fire department, or EMS station. ABPM is more useful than a single clinic or doctor's office blood pressure measurement. Since ABPM is performed over a 24-hour period, in certain scenarios, ABPM can provide more accurate blood pressure value. Ambulatory blood pressure monitoring can identify white coat hypertension and masked hypertension. ABPM is cost-effective in that it can prevent unnecessary use and overuse of antihypertensive medications, which can reduce healthcare spending. ABPM can also prevent hypertension from going undiagnosed. Thus, potential occurrence of cardiovascular disease and stroke can be avoided. Coverage and reimbursement are limited. Current payer coverage applies only to patients suspected of having white coat hypertension. Providers may be discouraged from performing ABPM because low reimbursement rates do not come close to covering ABPM's procedural costs. To bill for ABPM, these Healthcare Common Procedure Coding System, or HCPCS codes, may be used based upon the services provided with ABPM. The ICD-10 code R03.0, elevated blood pressure reading without diagnosis of hypertension, must also be present in the chart. Reimbursement codes in the state of Kansas are as follows. As you can see, the code 93784 for ABPM recording, scanning analysis, interpretation, and report is the most lucrative. ABPM must be performed for at least a full 24 hours to qualify for Medicare coverage. Coverage only applies to patients who are suspected of having white coat hypertension. This is defined as a clinic-measured blood pressure of 140/90 in at least 3 different clinic or office visits with at least 2 separate measurements each. In addition, 2 instances of documented blood pressure measured in a non-clinical setting must be less than 140/90. Finally, there must be no evidence of end organ damage. According to the United States Preventive Services Task Force, ABPM is the preferred method for diagnosing hypertension. They cite studies which demonstrate major differences between blood pressures measured in clinical settings versus 12 or 24-hour ABPM blood pressures. The USPSTF recommends screening for high blood pressure in adults aged 18 or older, as well as the use of ABPM to confirm high blood pressures outside of a clinical setting before beginning antihypertensive treatment. Receiving a USPSTF grade of an A, they recommend the service and feel that there is high certainty that the net benefit is substantial. Section 2713 of the Affordable Care Act mandates that any preventive service which has a USPSTF grade of B or higher be paid for. Health ICT is available to provide free technical assistance in developing an ambulatory blood pressure monitoring process for your patient care plans. If you're interested or would like to hear more, please contact us. We can be found at healthict.org.